Bone marrow transplantation is a procedure that is done in many centers across the world. So I thought I will try to tell you what is bone marrow transplantation. Let's talk about what is bone marrow. Bone marrow is nothing but the factory of blood in our body. Basically, bone marrow constitutes what we call as stem cells or mother cells, which when stimulated can develop into either WBCs or white blood cells, RBCs or red blood cells, and platelets. And we know that red blood cells are responsible for providing oxygen, the WBCs are responsible for providing immunity, and platelets are responsible for preventing bleeding from our body. So when the stem cells of an individual are transferred to either the same individual after high dose chemotherapy or transferred to another individual, then this procedure is called as bone marrow transplantation. When the bone marrow is collected and given back to the same individual after high dose chemotherapy, that is called as autologous bone marrow transplantation, and when it is given to another individual who is in need of bone marrow or stem cells, it is called as allogenic transplantation. In the previous years, bone marrow transplantation was abbreviated as BMT. Today, the full form of BMT by transplant physicians such as myself is blood and marrow transplantation and not bone marrow transplantation. So let me come to autologous bone marrow transplantation. Autologous bone marrow transplantation is done in individuals who have certain types of blood cancers such as lymphomas or the lymph node cancers. Hodgkin's lymphoma, non-Hodgkin's lymphoma are the two major types of lymphomas, and we also have a disease called as multiple myeloma, which kind of affects the bone and kidneys of an individual. So in this type of autologous bone marrow transplantation, after giving high dose chemotherapy to destroy the lymphoma cells or the myeloma cells, the stem cells of the same individual which were collected and kept in the fridge before giving high dose chemotherapy are then returned back to the same individual so that the formation of blood resumes in that same individual. Fortunately for us, these stem cells which are collected in the fridge and kept are free of cancer cells, and hence they can be given back by the process wherein we call as autologous infusion. In allogenic transplantation, wherein you give the bone marrow of one individual to another individual, it is given with the intent of either destroying the abnormal cells such as blood cancer cells in that other individual, or it is given after destroying the entire bone marrow of that other individual who is affected with the cancer. So allogenic transplantation is done very commonly for lots of blood cancers such as acute myeloid leukemia, acute lymphoblastic leukemia. It is also done in the pediatric age group for children who are affected with thalassemia, sickle cell disease, aplastic anemia, and many such indications.